Dear friends, is this just another World Heart Day that we are observing, or is there something which is different, which is rapid, and which raises a need to talk and discuss more about it? Well, I firmly believe that there is something which is very drastically changing and raising an alarm across the world and especially in our country. We can definitely say that we are presently dealing with an epidemic of cardiovascular diseases. And the fact which is most worrisome is that the average age of onset of heart diseases has shifted more than a decade, and sudden cardiac deaths have become extremely common. Earlier, it was very unusual and rare to see heart diseases in less than 40 years individuals. But if we look at the present statistics, nearly 25%, which is 1/4 of the heart diseases, are happening in people under the age of 40. There is something wrong happening somewhere, isn't it? So we all know the major risk factors for heart diseases are diabetes, hypertension, dyslipidemias, which means high blood cholesterol, alcohol and cigarette smoking, stress, abnormal sleep patterns, and many more. So actually, most of these disorders are nomenclated itself as lifestyle disorders. उनका नाम ही lifestyle disorders दिया गया है. So we can very clearly narrow it down to the lifestyle. The drastic changes in the lifestyle is what is the reason for this epidemic to the core. Dear friends, we have become very fond of getting influenced and trying to match up with the lifestyle of other continents, other countries. So it's okay to get influenced by others, but it's extremely important and crucial to understand the differences which exist, to understand that the lifestyle which is not causing much harm to them, and why it is causing so much harm to us. So dear friends, the inherent physiological, biological differences, the genetic differences have been thoroughly researched over so many years, and they very clearly tell us that Indians present with the cardiovascular diseases a decade earlier as compared to the people in the European countries. And 2/3 of the cardiovascular deaths which are happening in India are premature. So, in multiple studies which are trying to determine the reasons for this increased predisposition of the Indians to the cardiovascular diseases, these factors have been traced right to the perinatal period when you were not even born. So it includes perinatal nutrition, influence of parental factors, body composition, the percentage of fat in the body composition during early childhood, adolescence, as well as early adulthood, the metabolic rate, glucose metabolism, and insulin resistance, which is leading to high predisposition of diabetes even with the normal weight individuals. Genetic predisposition to dyslipidemias in Indians. These are some of the factors which make us more prone and more susceptible to the cardiovascular diseases. Many more markers are also under study, which includes air pollutants, COVID vaccinations, and many more. However, until more markers are established, more studies are done, we can definitely try to work upon those which have a clear role to play. So now, what is the solution to this? How do we go about? Definitely a multifaceted approach is required, which includes public health as well as health service level interventions at all the levels, right from primary, secondary to tertiary level. But today, I would like to urge to all of you to at least focus on what you can do at the individual level. So now, how do we go about it? We'll discuss some very common core things which we can follow to maintain a healthy lifestyle, a healthy prospect for maintaining a healthy heart. So the first important thing, dear friends, is a healthy diet. What we need to do maximally is reducing the intake of salt-rich food, of sugar-sweetened beverages, of completely avoiding the foods which are rich in trans fatty acids. Now we call trans fats as double trouble for heart, and they are known to give you bad cholesterol. So we need to strictly avoid the foods, the packaged, the processed foods which give us lot of trans fats. Now some of the examples for these foods are the cakes, the cookies, the pies, the frozen pizzas, the microwave popcorns, which are basically meant to get stored and then consumed. So please try to avoid the foods rich in trans fats. Kindly adopt to a heart healthy diet which includes whole grains, legumes, pulses, nuts, beans, more of green vegetables in the diet, more of plant-based proteins, more of healthy oils like olive oils, and avoiding the refined oils. So the most important thing is trying to understand that what our body needs quantitatively as well as qualitatively. Understanding what the body needs and fulfilling the basic demands is what is important to maintain a healthy lifestyle and a healthy diet. The second, of course, is staying away from tobacco, alcohol. The third important thing is avoiding a sedentary lifestyle. Please try to engage in a daily physical activity for at least 30 to 40 minutes for most days in the week. Please try to understand our body has very minimal and basic demands, but unnecessary giving stress to the body by an unhealthy lifestyle and unhealthy diet, we are creating lot of stress for the body, and we need to avoid creating this stress to the body until it starts falling apart. Please try to stick to healthy sleep patterns. Let us not play and disturb the circadian rhythms of the body. And the last but the most important is keeping preventive health checkups on a certain frequency. Please make sure you keep a check on your blood pressure levels, blood glucose level, cholesterol levels, and any further parameters as suggested by your doctors. Please come out of the zone which tells you that if you are not obese, if you do not have a family history of any cardiovascular disease, you need not go for the preventive health checkups. Please note that in our country, even normal weight individuals are fairly predisposed to diabetes, hypertension, heart illnesses. So we must make sure that we always get our blood parameters, our health checkups done on a frequency. It's definitely true that the high BMI individuals, the obese individuals, and people who have a family history are more prone and susceptible to cardiovascular diseases. However, even the normal weight individuals, the healthy individuals shall also get the preventive health checkups done on a regular basis. So the burgeoning cardiovascular diseases epidemics is definitely a matter of grave concern for all of us today. And if we all don't deal with this collectively, it's going to cripple our country with huge losses. So dear friends, your life is very precious, your heart is super precious. Please do take good care of it. Wishing you all a very happy World Heart Day. Thank you.